Hi, my name is Alex. I'm a nurse here at Marietta Plastic Surgery, and I'm going to talk to you today about breast implants. There are two types of breast implants, saline and silicone. All of the implants that I have pictured here are silicone implants. I don't have a saline here. They actually look quite similar. The main difference is just the feel. So I'm going to talk to you a little bit specifically about gel implants. Most patients are picking gel implants these days because they have some advantages over the fluid-filled saline implant. And the biggest advantages are that silicone implants feel more natural, they have less rippling, and they tend to last longer and hold their shape if they rupture. Saline implants, if the implant was to rupture, since it's fluid filled, your body would absorb the fluid and you would urinate the fluid out in hours, days, or even weeks. Silicone implants, if they are to rupture, they maintain their shape. This is an implant that we have cut with a knife actually, and you can see that when I press on the implant that the gel is contained and it doesn't go anywhere. So I could hang this upside down all day long and this gel would never escape the implant. So it's just as safe for you as a saline implant is. It's just nice because it holds its shape if it ruptures. The way that you would diagnose a ruptured silicone implant is through mammogram, ultrasound, or MRI. Most patients after the age of 40 are getting yearly mammograms, and if there was an issue, the person who is performing your testing would let you know that something just didn't quite look right and that the edges were not congruent, and so then they would probably send you off for an ultrasound or an MRI to confirm. If you do have an implant rupture, whether saline or silicone, it is recommended to have the medical device replaced. So you would come in to see your plastic surgeon and we would go over what it entails to have your breast implant exchanged. The rate of rupture, whether saline or silicone, is 1% a year. So even at 20 years, you have an 80% chance that they will not rupture. And most patients are probably replacing their implants on average around 20 years. Implants in the gel category have options of types of gel, and some of the implants are filled differently to provide certain benefits for different patients based on their needs. So we have Natrel implants here. We also have Mentor implants here. These are the two implant types that we offer here at Marietta Plastic Surgery. They do come in different price categories in relation to either the type of gel or the way that the implant is filled. So for Natrel implants, we have on display here their responsive, their soft touch, and their cohesive implant. And you can see as you move towards the cohesive implant, the rippling is less and less when it's turned on its side. The responsive is the softest implant. That's Natrel's classic gel implant. The soft touch is their most popular implant because it's kind of the middle of the road. It has a little bit more firmness, so you have less rippling, but it's not quite as firm as the cohesive implant. The cohesive implant is really good for our breast reconstruction cases, patients who do not have any breast tissue after mastectomy. So this is a really great implant for that because it provides a lot of projection and it has the least amount of rippling out of all the Natrel implants. Mentor has a similar type of implant here. This here in the middle is their classic gel implant. Both of these implants right here are the exact same size. They're both 400 cc's. They're also the same profile. Implants come in profiles based on your breast width. And you can see that their extra filled implant, it has less rippling, more projection, and it maintains upper pole fullness over a longer period of time opposed to their classic gel implant. This is also a classic gel implant, but it's a different profile. So that's what that is there for. Profiles are something that your physician will choose for you based on your breast width size and how much projection you're needing in your implant. Once you decide which implant you'd like, whether saline or silicone, and if you decide to go with silicone, what type of silicone that you would prefer, then you talk about implant placement. Implants typically are going to be going under the muscle or above the muscle. Most patients opt to do the under the muscle option because it provides some benefits in reducing the risk of capsular contracture. It also helps protect the implant and it minimizes rippling. Subglandular or above the muscle implants have not been as popular recently. They do require massage after surgery to make sure that the implant drops into its place and settles appropriately. Whereas a submuscular implant, the muscle will do that for you and you don't have to worry so much about massage afterwards. If you have more questions, we would love to talk to you and get you a chance to feel the implants yourself. So please don't hesitate to come in and set an appointment for consultation with one of our doctors. We also have a really cool device here called Vectra, which takes a picture of you and it creates an avatar. That avatar we can then morph not only implants, but we can also morph breast lifts if that's something that you need. And we can show you different sizes, different profiles, different implant types, and you can kind of see what you would look like after breast augmentation. Have a great day.